Thank you, Minister. You're very welcome, as always, to the House, and particularly welcome that you're bringing this bill before us. I think it is immense potential for us to streamline and coordinate our services for children. I think it's a huge and impressive undertaking which actually involves three source agencies: the HSE, the Family Support Agency and the National Education and Welfare Board. And Minister, I can certainly see the evidence of, and I can appreciate the serious hard work that has been done by yourself, Minister, personally, and by your department officials. And to that regard, I'd like to thank also Liz Canavan, Assistant Secretary at your department, for a very thorough briefing on the bill yesterday afternoon, and for your own clarifications, Minister, at that briefing. I fully agree with you that what we're striving for is to get the agency operational by 1st January, Establishment Day. In this vein, I want to be very clear that I'm approaching the bill in a very supportive and constructive manner as possible, and any issues I raise are only because we are all striving for the best agency, but I will do everything I can to ensure its passage through this House. I followed closely the passage of the bill through the Dáil, and I acknowledge and welcome, Minister, that you have actually made quite significant changes to the bill, and particularly in relation to ones that were based on suggestions by civil society organisations, such as the Children's Rights Alliance and Barnardo's, primarily, I would note. We do have a unique opportunity here to ditch ineffective systems and to finally make sure that children get the supports and services and treatment that they deserve, and that families get those supports as well. I am concerned, Minister, of the emphasis on management and the centralisation of services, which in part I understand, but part I fear of this creating of a bureaucracy. What we want to do is ensure that there is consistent standards throughout the country. An effective and accountable child and family agency will be a monumental step forward for the country that has so spectacularly failed some of our most vulnerable children in the past. We do need to ensure consistency and standardised practice on the ground. This opportunity has been a long time coming, and thank you, Minister, for taking the opportunity of bringing it here to this fruition. We know that history is unforgiving. Over 30 reports, as you have stated yourself. We need to learn from our failings, and we need to demonstrate clearly that we are learning from those failings. We are duty-bound to get this right, and everyone, I believe, is striving for the best outcome for children. I'll be submitting a number of amendments at committee stage and report stage in an effort to strengthen the bill before us today, but in all efforts I will be looking to see that we can bring it passage through the House, and I do look forward to a fruitful debate. Minister, I want to take the opportunity today to commend you for your role in securing government approval of a proposal to strengthen legislation around aftercare, namely by introducing a statutory right to an aftercare plan. And that, for me, speaks volumes. This will be done by the way of an amendment to the Childcare Act 1991 and is an essential component to ensure stability in care and to enable young people to transition from care to independence in a safe, progressive, tailored and appropriate way. And Minister, you can be assured of our support when you bring this landmark progress through the House when the legislation is published. But at this juncture, I want to focus on how we can ensure that we give the new agency the best start possible and that we restore public confidence in child and family services. Minister, you mentioned the referendum, and I too, when I travelled around the country, I think the biggest thing I had to deal with was how people had been treated in the past by the agencies, or how they perceived they would be treated. And perceptions actually are quite large about how people feel, and we shouldn't in any way diminish how people feel. And so for me it's important that we find ways to instil confidence in this new opportunity that we have here today. And in the news today, we see about the HSE potential overrun, and I'm not going to get into a debate on that, but that makes me even more concerned about the resources that are going to be transferred from the current HSE operations over to the Child and Family Support Agency. Can we absolutely say that there will be enough budget transferred to do what is already happening today? Can we guarantee that there will be no loss of services? What improvements will the public expect, and can they see? For me, I am concerned when I hear reports that potentially the agency could be starting with a deficit. It's like a ball and chain being added on the starting line, that in part of that transfer they would get a deficit. That for me would be totally and utterly unacceptable. We have an opportunity here with the agency and we need to use it. During the committee stage, Minister, I'll be looking at the budget, but particularly on the outsourcing. You know, we know the agency has a budget of approximately 545 million. 100 million of that, my understanding, will go to outsourcing, but I will be seeking clarity. But the big issue, Minister, I'd like to raise today, which is around special care, because for me it's quite indicative of some of the issues that I'm raising about confidence and how we go forward. Special care order on the Childcare Amendment Act 2011. Only children and young people who are aged 11 to 17 years with serious emotional and behavioural difficulties, that puts them, and I quote, at real and substantive risk to his or her health, safety, development or welfare, and is unlikely to receive special care or protection unless the court makes an order, can access these facilities. An example of this could be a child who's self-harming, who's suicidal, abusing drugs and or alcohol, and where all other attempts by the current HSE have not stabilised the current serious situation. And you rightly have to go to the High Court for a special care order, and this is an appropriate safeguard due to the nature and seriousness of such intervention steps and the restriction of that individual's liberties. And we saw the recent report by HICWA into Rathnanog, which raised very serious concerns, and the response from the HSE was to close the facility, which, my understanding, is a relatively new facility. And I think one could be forgiven with that action for thinking that there's no demand for places. But my understanding is that there are currently 16 children on a waiting list. And in reality, there's actually as many as 40 children who actually haven't got onto the waiting list in need of special care placement. And I just, having read the definition, I can't actually understand how there can be a waiting list for special care. I'm very conscious that we're sending children abroad for facilities, and to do this legally there is a time limit, and so it involves returning to the High Court time and again to extend the period. The state is paying substantial legal costs both legally and for the provision of these places outside of the state. Can we not develop a homegrown solution that would be in the best interest of children? In addition, I'm concerned with the current arrangements around applications and placement for special care. It's my understanding that the personnel in the HSE who decide whether we initiate a High Court application for special care are the same personnel who manage the number of special care places that are available. That, for me, greatly concerns because I feel they're conflictual. In fact, somebody said to me, the philosophy is, if we don't have a place, we don't make an application in the first place. Surely, need and the best interest of the child should be the driving and deciding factor in whether a special care order is sought. Are we failing children today? I'm not talking about the past, I'm talking about today. Like those 16 children who are on that waiting list. Are we failing them today who have been assessed and identified as needing special care? Minister, at the very least today, I'd ask for your assurance that this practice I've outlined will not carry over to the new agency. There cannot and there should not be a waiting list for special care. Minister, you rightly said that we need to look at bringing together services, cooperation. We must break down the barriers between agencies and services, and I totally agree. We need an informed, integrated approach, and for me, I would like it all to be under one roof, and that is one of the regrets I have as we go into this. Children with disabilities will not be under the roof of this agency. Public health nurses will not be under the roof of this agency. And all too often we hear how public health nurses are identifying upstream of where there may be issues in relation to a young child. At a recent meeting of the Health and Children Committee, the Special Rapporteur on Child Protection gave us really a masterclass in children's rights. And actually, one of the issues he raised was alcohol as a risk indicator. And that when social workers are going, it needs to be really considered as a risk indicator.
Senator.
No. And for me, the issues is, like, how will, all of these now communicate and liaise with the new agency? Because we've talked about integration, working together. I'll give, for example, Minister, I'll end with one example on the child and adolescent mental health services. By definition of their name, I think we'd all assume that they should be transferring over. They're child and adolescent mental health services. This is a child and family agency. They cater for young people up to 16 years of old, although they do sometimes extend to 18 years. The reality on the ground is that social workers say to me at the moment they find it extremely difficult to access CAM services, especially once a child is put into care, because it's almost as if the perception is they're in care now, the state cannot outsource those facilities, we'll do it here in the community. So it's actually costing the state. And there is concern that without them transferring, will this further exacerbate the difficulty that social workers are experiencing when accessing these services for children? We've seen the critical role within the child debt reports that the CAMHS services play. I don't understand why they are not part of the new agency. Is it because they don't want to be? And that really greatly concerns me. So, Minister, I've plenty of things I'd like to say, but we'll keep it for committee stage. I am concerned that the agency will really be about all children, will be about child welfare, and that we don't limit its remit. I think, Minister, I have no question about your commitment, but this, for me, bill is about outlining, it's putting down the foundations for the future. This is for years to come when none of us are here in this room. We need to ensure we have a unique opportunity, we need to grasp it, and we need to maximise that potential. Thank you.